I'll say good morning to everyone. I thank you for coming this morning. A group of mayors, Mahoning Valley River mayors, got together because of the COVID-19 to talk about what mayors could do to give their citizens a sense of comfort and give them more of an education of what's happening in our community. The number one thing that we came out of the conversation was to stay home if you're sick. If you're feeling sick, stay home. I think we're going to learn a lot more about how to become different in our lifestyle that we typically don't do. I know for me as mayor, I often like to shake hands, hug, and be in a social atmosphere. That life for me is going to change over the next 30 to 60 days. Citizens are going to have to learn that if you have public meetings, they may be canceled, or we may even go to a conference call for meetings. If you have meetings and gatherings, the governor did put out that there will be a large crowd gathering order that was put on by the governor, and we're asking everyone that's out there to adhere to that. It may be not you who are sick, you may be the carrier, and or taking it home to your family and your friends may be a bad idea. So when we're out for our social gatherings, we make sure that we are cognizant that we have to do it. Don't take a risk. If it's not necessary, if it's nothing that can't wait, postpone it. For me as mayor of the city of Youngstown and the other mayors in the room, we're going to limit access to our city halls. Right now, we're going to suspend in the city of Youngstown face-to-face water bill payments. If you're coming in to pay a water bill for the next 30 days, we're not having citizens come in to pay that. We're going to make sure that also you can pay online or by phone. Staff will be there on the phone to help you through that process. They will be able to answer those questions for you. If you're coming for a permit, call the department before you come. Security will be asking where are you going because this is a lot more about us doing things now than not waiting for later on for issues to come to a greater head for this community. Also want to make sure the citizens know that we're still voting. Voting is still going to happen on Tuesday, March 17th. The Secretary of State called and asked that I make sure that I reiterate that voting is going to happen. That people learn that there may be some off-peak times that they're going to ask people to go and vote. And early voting is still happening. That may be a great opportunity for you to go today as well as up till Monday. We want to make sure that they're looking for poll workers because we know many of our poll workers are mature age and they are most vulnerable right now. So we want to make sure that they're safe and they're not out at the polls. So they're looking for volunteers. There may be, you'll see the courts eventually talk about limited contact at the courts, where if you're not party to that case, you won't be allowed into the courtroom. The judges will be making that call, so you'll see that if you're not on the docket, the security may not let you in if you're not a party to that case. There may be certain opportunities for individuals who have serious health issues, and we're going to have our health director talk a little more about that. But if you are of serious illness, self-quarantine yourself. Take the precaution. We all have to take the precaution during these tough times. But the life that we knew last week, I believe even the life that we knew on Monday has changed. When we leave from this press conference, the life that we know right now after we had this conversation is going to change for all of us. And as mayors, we want to be consistent. We want to make sure the citizens know that we're working as a great deal together so that we have a message that everyone's looking at to say, here's where we are. We are taking our cues from the governor and the director of health, Dr. Acton, to make sure that we are doing what we can do on our part. And I'll have my colleague, Mayor Doug Franklin from Warren, talk a little bit about more of some of the actions that the mayors are taking throughout just the valley, because this is not just a Youngstown issue. It's not just a Warren issue, not a Struthers or Camel or Now. It's an issue throughout the world and throughout our community. Mayor.
Thank you, Mayor. Good morning, everyone. As Mayor Brown, first of all, I want to thank Mayor Brown for taking the leadership and bringing us all together, the healthcare professionals, state officials, and us mayors. We're fortunate as the Mayors Association that we worked on a lot of projects in the past, so we're sort of prepared to extend that collaboration to this issue. As Mayor Brown said, this virus COVID-19 doesn't respect or limit itself to political jurisdictions or cities or communities. So we're working across those jurisdictions to work together and to speak with one voice as mayor. So that's very important. I can't say enough about how it's refreshing to exchange notes with the healthcare professionals. We're taking our directives, as all of the communities represented here, straight from the Ohio Department of Health. I will say that with Director Colbert, who's here today, my Safety Service Director, we've taken on a lot of the same measures that Youngstown has. We will be extending our income tax preparation deadline for 30 days. We're limiting, or if not eliminating, all person-to-person exchange of water bills. We're working with our court systems to limit access to that. So we're working on those issues, particularly with social gatherings, face-to-face contact with everybody. And I just want to say one thing before I turn it over to the other mayors. We need to be prepared. We need to practice prevention, and that trumps panic at every single instance. So I'm asking all of us to do that. We need to really focus on those preventative measures that you're going to hear over and over and over again, but they're extremely important, and we want you to take heed to those. So I thank you for calling this press conference. We got a lot of work to do. We're also we're going to copy your Zoom press conferences with our department heads. We're going to limit that as well, and also limit access to City Hall to some extent. But government has to keep running, and we will. But we'll be doing it in a different way, and all of our lives are changing as we speak. So thanks, Mayor, again, and God bless you all, and let's roll up our sleeves and get this thing under control.
This time we'll have Dr. Kravick from Mercy give us kind of an overview on the medical side of the world and what's going on.
Good morning. My name is Dr. Jim Kravick. I'm the Chief Clinical Officer at Mercy Health in Youngstown. I also serve as the Mahoning County Public Health Medical Director. And I was asked to speak a little bit about the preparedness of Mercy Health both in the hospitals and also in the practice sites, and to help the community. And really, this has been going on, as many of you know, since early January, with learning about what's going on worldwide. And as we've continued to learn, both Mercy Health locally as well as system-wide has worked very closely with the health departments in Youngstown and Mahoning, Trumbull, and Columbiana counties to take their lead. Really, this is a public health business that we're working with the health departments, both local and Ohio Department of Health, as well as CDC. The CDC and Ohio Department of Health give us great guidance, and we are listening to Dr. Acton and Governor DeWine for their updates and their guidance. Locally, as we handle our hospitals, as you know, Mercy Health has St. Elizabeth in Boardman, St. Elizabeth in Youngstown, and St. Joseph in Warren, as well as many access points of care, including 25 primary care sites. As we continue to focus in, you're going to continue to see changes, some of which have already happened and some that are going to continue to happen. And this is part of our plan. For example, you saw the tent that went up in the parking lot of St. Elizabeth Youngstown Emergency Room yesterday and the day before. That was part of our plan that was put into place in January as we continue to see increased volume and to care for our patients in need. And part of the plan is how do we care for more patients with respiratory illness, flu, the novel coronavirus, and other respiratory illnesses, and how do we handle the increased volume. And that is one area we thought would be a great way to take care of the patients. So it's part of our disaster planning that we've had in place for years. And you may continue to see other changes like that at our hospitals and office-based practices. The question comes up about where do we go if I want to get tested? That question I received many times is, how can I get tested? If you are well, if you do not have symptoms, if you have very minor symptoms, you cannot get tested right now. The testing is limited because we don't have enough tests available. That will continue to change by the day. By the hour, we get updates. So right now, Mercy is working, and we'll have, hopefully by Monday morning, two new sites of care that will be open, one in Trumbull County and one in Mahoning County. More details will follow about those sites of care, but the point of those is having more access for care, and details of who should go to those sites and what services will be offered there will be forthcoming when we have more information. But we want people to call their physician if they're concerned. The emergency rooms are always busy, but we need to keep those for patients that need to be in the emergency room. It can't just be for because I want to get tested. It's not available right now. There are criteria for testing. There are algorithms that health professionals follow as far as when you can get tested, and we must involve our health departments and our infection prevention folks to decide if we test or not. And so that's a very important fact. Labs are getting certified through the government for testing, and that is continuing to evolve. I heard one more company last night received approval, and that's a good thing. But right now, we don't have numbers of tests available that I can tell you we have, but we know that will continue to increase. Last point I have is really as far as visiting restrictions, both at nursing homes and at hospitals, you are going to continue to see limitations and restrictions. We will have more announcement from a Mercy Health standpoint later today as far as our limitations on visitors. It's very important for the social distancing. We know that patients want to have visitors, and it's very important for their physical and mental health, but it also is very, very important to keep people away that don't need to be there. Mayor Brown mentioned about limiting access in City Hall, and Mayor Franklin said the same thing. So as we look at our facilities, our nursing homes where our most vulnerable patients are, we don't want to contribute to harm by having people close who might be sick and spreading that around. So I guess my take-home point is we are prepared for what's happening, continue to evolve, and most importantly, we work with the state and local health departments. Thank you.
Can you touch on what the Congressman said about kids in 17 and under carrying the virus, about the grandparents and things like that?
So according to the CDC, the most vulnerable population is those over 60, and we know that. We know that many of the children, 17 and younger, are carriers, and they may or may not have symptoms of the virus, but many of them have the virus. Some have symptoms of common cold. Some with chronic illnesses can get serious illnesses, but most children who don't have chronic illnesses may have either no symptoms or very mild symptoms. And limiting the connectivity between children and the older adults is very important as well, because that can contribute to the spread to those that are most vulnerable, which is those over 60. Thank you.
And Bishop, Health Commissioner from the City of Youngstown.
Good morning, everyone. Just wanted a couple of things to talk to you about is just being an open communication and working with, I know with the health department. I look at yesterday, I know Eric Ryan's here. I know it wasn't easy to cancel the Cavelli Center, but everyone's being cooperative. We're working with our restaurants, working with places that house more than 100 people, what we should do. I give credit to our team here at the health department. We have our director of nursing, our director of environmental health, and our director of minority health all here. We work as a team together. I will say all the information we get to is up to date. We really work for Dr. Acton and Governor DeWine, and as soon as they get it to us, we're on a press conference every day, watching it. As soon as we get it, we put it out to our residents as well as our businesses. I just kind of keep repeating. I know yesterday I had to make the phone call to my priest at St. Christine. I know they said March 20th we could quit doing the fish dinners, but how about tomorrow just do carry out? That's kind of those hard calls you have to make, and people really look forward to that, and this is time that we're out meeting together, but that's no longer happening. So if you are feeling sick, please stay home. We are not closing down our vital statistics yet. That would be a call we'd get from our state. So right now, if you need a birth certificate, we're limiting the amount of people that do come to our health department, which is located in the Youngstown Municipal Building. We ask that if you do come, like I said, we separated all of our chairs 6 feet apart today. But for those that can, you can get your birth certificate online. It is real simple, vitalcheck.com. I know that's really important right now, especially we're so crowded right now with all the changes with the BMV and people needing to get their driver's license. So if you can stay home and get it offline, you could also call the health department, and if you send a self-addressed envelope, we can mail you your birth certificate. So we're trying to do as best we can for people not to come in to the health department, but we know that people do need to come. Again, we keep constant communication with Mercy Health, with the mayor's office, and again, I talked to all the other mayors here today, really just encourage them to work with their local health departments, put it on your websites. all of our information is right on our front page for the city of Youngstown, so that all of our residents get the same message out. And I do encourage the CDC and the Ohio Department of Health is where you should get all of your information at. You know, no other, it's hard with social media these days. And again, stay home. We see the kids are in school for 3 weeks. So we're going to see lots of changes. And again, they happen every single minute. We get something new. Every single day something comes out. Last week, you know, limit amount of people at nursing home. Now most nursing homes are not allowing any visitors. So you're going to see these coming through each day. And, you know, that is our job, is to make sure that you find out. As soon as we find out, we'll send it out to you. So again, thank you for your attention, and I thank all the mayors up here and Mercy Health for all your support, our team at the Youngstown City Health District, and we have a number that you can call. At our health department, there'll be someone there, and we'll put you to the right direction. I did want to make note that we do not have anyone in the city of Youngstown under investigation right now. We did at first a month ago when the woman came from China because she had that connection. We worked with her 14 days. We called her twice a day, did the surveillance that we were supposed to, and she did not have the coronavirus, never came down with the symptoms. But, you know, that's something that we will have to do when it does come to us. Right now, there's no one in the city of Youngstown under investigation, so I just wanted to make that clear. So thank you.
Anybody else, anything, Michelle, from the state side, you want to talk about the budget and issues that may be coming down from the federal government?
Okay, thank you. Yes, I'm Michelle Lepore-Hagan. I represent the 58th District, and I'm glad to be here today. This is an effort that we all need to be working together, and from the local government, to the state government, to the federal government. I've urged our governor and our leaders at the local, in the General Assembly, to release some of our rainy day funds so that we can have more money for our local government, so we can support our healthcare providers. And we need to address what is going to happen with our small businesses, and, you know, release some funds so that we can provide some assistance for them, and also our children that are going to be our school children that are not going to be able to have their 3 meals a day. We'll be working with the CEO at the Youngstown City Schools and the mayor to address those issues of how we will provide food for these kids that will be missing 3 meals a day for the next 3 weeks. So I'm glad to be here today, and I want to share the support, that anything that I can do through my office. I will be working with the governors, with the mayors in my district. So thank you. I will hopefully be working with the governor to provide more local funds for our district. Thank you, mayors.
Thank you so much. What we all have to remember is that there's going to be some difficult times, some times that I can't tell you any of us in this room have had the opportunity to deal with. Kindness is going to go a long way. Flexibility is going to go a long way. To really realize that the way that we operated is not going to happen the same for some time. I know local government, we're going to operate a little different, but as citizens, I ask that you join in with us to really understand that this is not any of us by ourselves. We're all in this together, but we all must make this work together. So at this opportunity, we want to make sure that you heard me talk about earlier where we're canceling face-to-face meetings with teleconference. We're actually going to, the mayors will probably not meet again in face-to-face. We're going to go on Zoom. We're going to go on teleconference, and we're going to make sure that we continue to communicate, talk to my cabinet, that we're not going to assemble in my conference room and congregate like we used to do. We're going to go on Zoom, so we're going to go conference calls, and let's use technology to help us. We can still get the job done. We can still figure out and have communication. We just got to do it a little different.
717 Credit Union. Business services designed to meet your daily needs. Commercial loans, business deposits, merchant and payroll services. 717 Credit Union. It's knowing you were treated right every time.